School will be different when students return to school under the Phase 2 limited hybrid model. We encourage you to review this video with your children so everyone knows what to expect. All of us, students, families, teachers, and school staff, can help prevent the spread of COVID-19 and keep our schools and communities strong. You will recognize much of this guidance from the acknowledgement you signed when you registered your child. During the limited hybrid model, students will attend classes 2 days per week in person and 3 days per week virtually. Students will be divided into two groups. Group A will attend in person Monday and Tuesday, virtually Wednesday, Thursday, and Friday. Group B will attend virtually Monday, Tuesday, and Wednesday, in person on Thursday and Friday. Every Wednesday is a deep cleaning day for our schools, so all students and staff are working virtually. Student Group C will continue with virtual learning. Schools are required to send students and staff home or to medical care if they have recently tested positive for COVID-19, been in close contact with someone who has tested positive for COVID-19, or have a fever, chills, shortness of breath or difficulty breathing, new loss of taste or smell, a new cough, or any other COVID-19 symptoms that may appear 2 to 14 days after someone is exposed to the virus. When children are in school buildings, the day will feel and look different. For example, your child will eat in their classroom instead of the cafeteria, and they will be asked not to share school supplies with other students. These actions will help prevent the spread of the virus and will be required. Wear age-appropriate face coverings that cover the nose and mouth. Students will be asked to wash their hands frequently with soap and water for 20 seconds or to use hand sanitizer. Students will be asked to leave plenty of space, at least 6 feet, between themselves and other children and staff. Teachers will ask your child how they are feeling during the day. It's important to encourage your child to tell an adult if they start to feel sick or if they are feeling worried about the new health precautions at school. Heading back to school requires that all know the symptoms of COVID-19. If your child or anyone in your household exhibits any symptoms, you will need to keep your child at home. Everyone will be screened before entering a school building with both a temperature check and screening questions regarding symptoms. Screenings will add time to the morning arrival, so please arrive early. Transportation will not be available for Phase 2 in-person learning except for certain students with disabilities, nor will before and after school care. Parents should ensure their children arrive on time and are picked up promptly when the school day ends. Please check our website for your school's bell time. Schools may request students bring additional supplies this year, such as hand sanitizer and plastic bags or pouches in which to keep their personal belongings. Nutritious meals will be available through the school nutrition program. Students and staff will be required to wash their hands before and after eating, and meals will be eaten in the classroom instead of the cafeteria. Staff and students should wash their hands often. If soap and water are not available, you may use an alcohol-based hand sanitizer that contains at least 60% alcohol as stated on the product label. There are other considerations for returning to in-person learning. As safety precautions dictate or as COVID cases may occur, sports and other after-school activities may have to change or be canceled. Your child's school will provide information. Because the health and safety of students and staff is a top priority, schools will limit outside visitors. Only those directly involved in the education process will be allowed in the building. Family members will not be able to have lunch with their child or volunteer in the classroom. Parents who need to visit the school to address educational matters regarding their children may do so by appointment. We encourage you to have a plan for someone to pick up your child if they or someone in their class becomes ill during the day. If a student or teacher tests positive for COVID or has been exposed to someone who has tested positive, contact tracing will be conducted to determine if any part of the school should close, who should be contacted, and if testing is needed. Please talk with your child in an age-appropriate way about how going back to school will feel different than usual. Encourage your child to share how they are feeling. All of these changes may be stressful for children. You should let them know that their feelings are okay. Please contact your teachers with any concerns. We encourage you to communicate with teachers openly, honestly, and promptly about your child's health and the health of your family. Please follow all health requirements required by your child's school and ask questions about any new processes. For the most up-to-date school information, please check your school's website, the district website, or our social media channels. Your child's teacher is the first point of contact should your child or someone in your family become ill. We hope this video is helpful in our return to in-person learning. SCCPSS will continue to monitor COVID-19 transmission rates in our community to ensure the safety of our students and staff. We thank you for your continued support of Savannah-Chatham County Public Schools.